Good morning. I'm Lisa Guthrie, the Executive Director of the Virginia Transit Association, and I'd like to thank you for joining us this morning for our webinar, Transit-Driven Complete Streets. We're recording the webinar, and it will be available on our website along with the slides for on-demand viewing. We will save all questions for the Q&A portion of the webinar after the presentation. We, of course, encourage you to send your questions anytime during the webinar, and here's how to do that. Look for the webinar panel on your screen and simply type your question into the question box. And although they'll be answered at the end of the webinar, you can submit your question at any time and we will hold on to them. Remember that the audience is muted, so we'll be unable to hear you during the webinar. We have an outstanding presentation today, providing you with a great deal of valuable information from three industry leaders on complete streets. And here's who they are. First, we have Nimotali Aziz, and we call her Nemo. She's a program associate with the National Complete Streets Coalition. She's responsible for tracking and reporting complete streets policies around the country and coordinating membership outreach on behalf of the coalition. In addition, she is involved with planning annual Complete Streets events, such as the 2018 Intersections Conference. Before joining Smart Growth America, Nemo engaged in communities around bike share programs in Brooklyn, New York, and New Brunswick, New Jersey. She also served as an ambassador and research assistant for the New Jersey Bicycle and Pedestrian Resource Center. Nemo holds a Master of City and Regional Planning degree from Rutgers University and a Bachelor of Arts in Community, Environment, and Planning from the University of Washington. Next, we have Rich Weaver. Rich is the Director of Planning, Policy, and Sustainability at the American Public Transportation Association, which we call APTA, in Washington, D.C. He serves as staff advisor to the APTA State Affairs Committee, the APTA Policy and Planning Committee, and its subcommittees. He also oversees the work of the APTA Mobility Management Committee and is the co-director of the National Center for Mobility Management and is liaison for FTA Region 3 there. As staff advisors to the State Affairs Committee, Rich serves as the liaison to the State Transit Association members and state DOTs. He's responsible for keeping track of rules, regulations, and guidance affecting transportation planning and program, as well as issues related to new starts and small start project development. Rich has been with APTA for over 30 years. He also chairs the National Complete Streets Coalition Executive Committee. Next, we have Fred Jones. Fred is currently Senior Project Manager with Michael Baker International. He has over 15 years of public and private sector experience for a variety of community planning and mobility projects. His expertise includes multimodal transportation planning, corridor studies, complete streets, traffic impact analysis, public engagement, as well as extensive experience in regulatory issues and mixed-use development. Mr. Jones' training in anthropology led to his career in planning, as he believes urban planning is anthropology. Most recently, he served as Senior Transportation Planner with the Jacksonville Transportation Authority, or JTA. In this role, he oversaw JTA's Complete Streets program, which seeks to increase the first and last mile accessibility and safety of JTA's newly designed transit system. Mr. Jones is a certified planner with a master's degree in urban and regional planning from Florida State University. He's currently the chairman of the City of Jacksonville's Downtown Development Review Board and was recently elected to the City Council of Neptune Beach, Florida, where he intends to promote more livable and sustainable mobility solutions. Thank you all for sharing your expertise and helpful information for us today. And with that, it is my great pleasure that I turn the webinar over to you presenters now. Welcome.
Hi, thanks, Lisa. This is Nimotali with the National Complete Streets Coalition. We're a program of Smart Growth America, and the coalition is made up of public interest organizations and transportation professionals who are committed to developing and implementing complete streets policies and practices. The Complete Streets movement and the coalition started in 2004. And really a Complete Streets approach looks at integrating people and place into design, construction, operation, and maintenance of transportation networks. So overall, what we do at the coalition is really lead the charge on the national level by providing technical assistance, research, policy tracking, and guidance. I'm sure all of us here know the importance of transit. Next slide. Personally, it's been a big part of my life and influences the way that I get around. When I lived in Seattle, I definitely used the bus and light rail to get everywhere. And now that I commute to DC, Maryland, I rely faithfully on my 40-minute metro ride to get me to work. However, when thinking about how we improve transit and first and last mile connections for everybody, we have to think about who depends on transit the most. We'll hear more about Jacksonville, Florida later on in the presentation. Next slide. But just some quick stats. Those who take public transportation in Jacksonville are over 3 times more likely to live in poverty. And Black residents make up over half of the public transportation commuters. So clearly we have more work to do in terms of improving transit connections for low-income residents as well as people of color. And with that, I'll turn it over to the chair of the National Complete Streets Coalition.
Thank you very much, Nemo. Thank you so much. It's a pleasure to be with everyone this morning. I'm going to provide a, next slide if you could, an overview of my agenda will include a Complete Streets for Better Transit agenda. Next slide, please. I'm going to give some case studies from Reno, Austin, Washington, D.C., and San Diego, and then with some resources. Now, Complete Streets policies ensures that the entire right-of-way is planned, designed, operated, and maintained to provide safe access for all users. And that's what Complete Streets is about, making sure our transportation network works for all users every time there's a new project. APTA is a supporter of Complete Streets and has been for many years. Transit agencies believe access and connectivity are keys for linking people and places, land use, and transit decisions. Now, in most transit systems, the vast majority of riders access transit by walking, rolling, wheeling to stops or stations. APTA's Who Rides Public Transit report notes that 69% of users walk to transit. Enhancing the safety and attractiveness of the pedestrian environment, such as safe crossings, adequate sidewalks, and attractive streetscape, will make streets safer and more welcoming to people using public transportation. These projects also impact transit operations, the stop location, travel times, reliability. So transit agencies should be brought into the planning process early for Complete Streets. Now, transit agencies need to partner with local governments and municipalities to focus improvements in conjunction with Complete Streets projects, and can also be a source of funding for bus stop improvements as part of an overall project. The complete trip from out the floor to the rail station or bus stop, the ride along the corridor, and final destination are important elements of Complete Streets. If I could have the next slide. With better connections to transit, there are much more benefits for overall to the users. And they include improved equity, increased access to jobs and affordable housing, making better use of resources, limit road vehicle miles traveled, control rising costs of road construction and maintenance. Now, also the benefits is safety is improved with reduced crash rates. With Complete Streets, there are abundant and safe crossings with good sidewalk street connectivity. As we know, safe and reliable service depends in large part on how the street right-of-way is designed and how it functions. Another benefit is the increased value of development. The importance of transit varies based on the nature of development. However, proximity to high-quality transit service does increase the value of most development if transit is not just proximate but accessible. Complete streets are essential to paratransit customers who prefer to use fixed route instead of paratransit for most trips because the ease of access, location of stops and vehicles and transit service are welcome to individuals with mobility issues. If I could have the next slide. Now this is an example of what not to do. This bus stop lacking amenities. You can see no crosswalk, no sidewalk, no protection from sun or rain, no room for amenities, difficult location for a bus stop sign, hazardous ditch. And unfortunately, there are too many stops and stations like this. Okay, I have the next slide that shows you a better example. Now, the regional in Reno, there are several. They have used what they call a bus stop toolbox. There are several factors that determine placement of bus stops: operations and maintenance factors, passenger preference, accessibility, property owners issues, ordinance and regulations, and of course politics. And in this photo, you can see the type of infrastructure that agencies incorporate in their projects to make accessing transit easier. The Regional Transportation Commission of Washoe County, which is both a transit agency and a metropolitan planning organization in Reno, has implemented a Regional Complete Streets initiative that helps guide their transit projects. Because of this policy, RTC has developed a bus stop toolbox that they have recommended to transit agencies. So I encourage you to work with your MPO to create a complete streets plan, and a bike and pedestrian plan, and Americans with Disabilities and Access Transition Plan, and work with developers and work with stakeholders. Next slide, please. The Capital Metro is partnering with the City of Austin to collect field data relating to the accessibility of pedestrian pathways in Austin. They use GIS software loaded on tablets to collect data on sidewalks, driveways, curb ramps, and crosswalks. Pathways are graded using the following classifications: compliant functional, which in other words, a pathway meets all ADA requirements; non-compliant functional, pathway has some minor issues but may not be accessible to all passengers; and then non-compliant, non-functional, pathway has major issues and is not accessible. And based on the data collected, Capital Metro and the City of Austin will partner to make repairs and improve accessibility. And in the future, Capital Metro plans to use crowdsourced reporting of accessibility issues through a TRIP app. Next slide. The San Diego Association of Governments, SANDAG, is a public agency that serves as the forum for regional decision-making and is comprised of 18 cities and county government within San Diego. And safe routes to transit is a term used to describe street and sidewalk improvements that make it safer and more comfortable for people to walk or bike to and from transit stops and stations, as well as at home, work, and retail destinations. Safe routes to transit access improvements are designed to enhance access to transit, but benefit everyone who walks or bikes in areas up to a mile away from the transit stations. SANDAG developed a framework for developing potential safe routes to transit needs, project types, and costs through the San Diego region. Now, safe routes to transit is required for every new transit project. Next slide, please. In Washington, D.C., WMATA has a Metro Rail Station Area Investment Study, and WMATA has compiled an inventory of unmet bike and pedestrian access needs at all 91 metro stations. They then score these projects using 12 measures, which include measures around safety, ridership, equity, and path to services. Based on the top scoring projects, they receive priority for funding and implementation. Next slide, please. Now, I want to just mention a few of the resources that are available to folks to can help you work through some of these issues. The APTA has developed a few recommended practices for transit agencies that do touch on complete streets and transit agencies. In particular, defining transit catchment areas provides information for assuring quality access to transit. The diagram on the left illustrates the transit catchment area or potential transit riders within a given area around transit. And having good connections for both pedestrians and cyclists increases the transit catchment areas and potential ridership. Being successful at implementing complete streets around transit requires the effective partnerships of many stakeholders. The Transit Agency Partnerships to Improve Urban Design and Enhance Service Effectiveness document provides valuable recommended practices for successful partnerships. Next slide, please. And then APTA has a recommended practice for the design of on-street station stops and access from surrounding areas. Transit agencies use this document to look at existing or new on-street transit stops and to provide input to local jurisdictions and developers to invest in pedestrian improvements. Local jurisdictions and the general public use this document to facilitate discussions about planning, design, investment decisions made by public agencies and elected officials. Developers, planners, and architects also use this document in making design decisions regarding the interface of private development and the public realm where transit is presented or planned. So that completes my brief overview, and I will be happy to look forward to answering questions after Fred. So Fred, I'm going to turn it over to you.
Thanks so much, Rich. Next slide. We'll get into the story a little bit about Jacksonville, but I think this will resonate quite well with transit agencies. And really in Florida, this particular story is almost a case study on how do we address a true public health crisis through our street design. Next slide. Just a little bit about the agenda. What I'm going to do is kind of give everybody a little bit of an overview of Jacksonville geographically and as a city, as well as JTA, some of the catalysts for why we developed this Complete Streets program, go into some of the processes that we did and some of the concepts, as well as wrapping up with some next steps and potential lessons learned for other agencies that are embarking, particularly on those that are embarking on system redesigns, as I know a number of you in Virginia are doing that. Next slide. So a little bit about Jacksonville. As you may know, I always say it's that first city you get in on 95 in Florida on your way to Orlando. But anyway, the population of Jacksonville, about 850,000. It is a consolidated city government. Duval County and City of Jacksonville are essentially one and the same, and it is the largest city in the contiguous United States at 840 square miles as a result of this consolidation. Growing Sunbelt city, and currently behind Tampa in terms of the second most popular for relocation. So it's a fast-growing place, and as you can imagine, similar to a lot of larger cities in the Sunbelt, transit has been a challenge because of the low-density development pattern spread across the region, and trying to connect people has been a little bit of a challenge on the transit system, and so that was part of the rationale for the redesign. Next slide. A little bit about JTA, and JTA is one of a handful of organizations that actually began as a road building entity. So in '55, it was initially an expressway authority charged with building toll roads, and only became truly multimodal when it took over some of the private fledgling bus operations in the late '60s. Its responsibilities now is beyond just roads and bridges, but the fixed route bus, a newly launched bus rapid transit system. We've got paratransit, a Skyway monorail system, which is actually going through a modernization program to determine what to do with that, as well as some trolley services and a Sunday game day shuttle to the Jacksonville Jaguar games. Currently, the fleet's about 220 and about 13 million annual trips. Next slide. So a little bit about what this program, at least the catalyst to it, as I mentioned, a number of communities across the country in the last few years have been going really essentially starting fresh, realizing that the iterative approaches to modifying their transit network is not very effective. And in Jacksonville in particular, I think the fixed route bus prior to the route optimization initiative redesign was essentially a countywide paratransit operation. So this was one of the most transformative projects in the history. JTA had no high frequency service, one or two routes with 30 minutes, but no 15-minute service, which was something that we really urgently needed. So with this, we eliminated about 2,500 bus stops, enhanced the arrival and departure times, and created about 20 new routes with 15-minute service. Next slide. But as you can imagine, and as well, I mentioned too, there's a BRT system that's also in development. We've launched the Green Line and the Blue Line on the southeast, and they're looking to expand that as well. So what you really are doing is creating this sandbox of really a high frequency transit network within Jacksonville. And in doing so, go here to the next slide. We recognized that there was a need to do something else. One of the other big issues here that we recognize, especially it became apparent when you redesign your system, you recognize that people have to walk a little bit further. I often show this sequence of slides, courtesy of the National Complete Streets Coalition. They've actually updated this to really show what this is. You can continue to go through these slides. These are pedestrian deaths. And Florida, as I say, is number one. And Jacksonville, unfortunately, does a good job of killing cyclists and pedestrians, and particularly those in areas, economically disenfranchised areas, and those people that are actually walking or riding their bike to the transit system. As you continue, Jacksonville, I mean, it truly is a public health crisis. And as we started going through this process, we recognized not only are we redesigning the system to make it more frequent, but it's really a horrendous experience for customers now that have to walk a little bit further to the stops. And what is that experience like for people now that they have to walk a little bit further? There's a lot of sidewalk gaps. There's a lot of really mediocre infrastructure that doesn't support walkability. And so that was one of the big catalysts to think a little bit differently. Next slide. And you can see this right here on the list. This is the courtesy of Dangerous by Design. Really, Florida continues to have 8 or 9 in the top 10 list. So we do a really poor job. And really this became the calling card for thinking about using Complete Streets as a tool to really enhance the customer service experience. How does Jacksonville get off this list? Really became the call from leadership. Continue. Next slide. Again, when you combine for cyclists and pedestrians, we're actually the worst state in the United States. So all these statistics really paint a horrendous picture. And again, recognizing that we're forcing a lot of our customers to have to walk a little bit further to the stop, and it's a series of trade-offs, we really recognize that we had to do something different. Next slide. That's just some images of stories. Just about every day you'll see pictures. These next series of slides really kind of give you a snapshot of what the conditions are like on many of the high frequency, which we almost called our sandbox, our high frequency transit network. People, expansive distances between signalized crossings. Human beings don't want to walk a half mile down to the cross. They're going to follow the path, and yet we don't have, mid-block pedestrian crossings are really a rare sight in the city. This is near a hospital. Gentlemen, that a lot of people ride their bikes to the stops, and this is one of the highest ridership locations just north of downtown Jacksonville. But as you can see, there's no amenities for somebody that's cycling. This picture here shows a child that's actually walking out in front of the vehicle. His parents are on the other side, so this is just kind of the everyday experience for people that do not have an automobile in the city, an elderly woman, And this is something that you can find just any particular day. A lot of ADA access issues as well here. So you can imagine if you're trying to get around this, you don't have the 3-foot clearance for a wheelchair. So it really becomes kind of a call to arms. You can go through some of these slides. This just sort of follows a person to the stop and what are those conditions like. And I always say that it's just so important from a transit agency perspective that, as a customer service, mission, that we really have to think beyond just from the stop to the bus to the location, but really what is it like for Mrs. Johnson, who is going on a shopping trip, to walk from her front door to the stops. And we just often forget about that. And unfortunately, many times the transit agencies don't have that design control or the influence to really be able to make a difference. And I think this is, as we continue to go through the system redesigns, this is an opportunity, I think, to really start to partner with our agencies and work and see what this is like for the transit users and how we can leverage Complete Street tools to help correct these serious deficiencies that continue to, haunt a lot of places. And it really, like I say, I can't couch it in any way than a public health crisis. Next, a little bit about our program. This, after doing the route optimization initiative, those corridors in blue within the city became really the high frequency network. These were the corridors that had the 15-minute service. And this became kind of this program. So JTA was able to do some bonding of improvements and had a $15 million set aside to do stops and sidewalks, a little bike lane. But at the time, it was really nebulously defined. We just figured, well, we'll go out and use this to correct some of the stop deficiencies and maybe some sidewalk connections. But it really it grew into something more. So, well, we should really be leveraging the Complete Streets program to really rethink differently about that. And as you can imagine, you spend $15 million across what amounts to a total of 75 corridors doesn't really go far. So we realized that we had to spend our money wisely and develop a set of meaningful demonstration projects that can have an immediate impact. And so that's how we allocated the funds. Next slide. There's, again, all of this guidance, I encourage a lot of transit agencies to really become aware of the NACTO publication and tremendous amounts of resources. The Florida Department of Transportation has launched a Complete Streets implementation plan. The stuff is from the coalition. So there's all these resources, to really use and leverage as kind of a tool, if you will, to help improve this first and last mile conditions. Next slide. Again, some of this is stuff from the DOT. This is their website, their program. Next. So a little bit about the process. And I mentioned early on, we had $15 million. Recognizing the risk of, you could spend all of that like on one corridor, if you will. We wanted to develop a set of meaningful demonstration projects that illustrate the improvements to the transit network. I encourage a lot of agencies to do this. This is what we call a 5D analysis, and D stands for density, diversity, design, destinations, and distances. And so these are really measurable. So we took those corridors and divided them up into quarter-mile grids. And what this really did was create a more or less a hotspot analysis of where we should target those investments. Next slide. So the corridors essentially look like this. Those areas in red are those where we had tremendous opportunities to go in, where you say, here gives you at least some physical ingredients for, propensity for walkability and high ridership. And so it's just at least a lesson for folks to say, here, if we were to start someplace, where should we begin? It gives us a little bit of a path forward. And we did a set of walk audits as well to determine, hey, these are the places near our high frequency, high ridership stops that we should be focusing on the improvements. Next. We went through a period, this was in between late 2015 and early 2016, a set of design charrettes, going out, talking to the folks, riding the bus, walking and riding your bike to those stops, engaging with the community, and really thinking about this not just through the lens of an improvement to stop at how we can use placemaking as a philosophy as well to really try to improve the neighborhood through this program as well, or at least to catalyze improvements through complete street retrofits. Next slide. And as I mentioned, the importance of getting demonstration projects and showing some meaningful change. You know, there's a lot of things that you can do with complete streets that are low cost, as many of you probably are familiar with, that say, hey, you know, if you were just to do a restriping, a simple reallocation of the space temporarily to show how things can work and really demonstrate some meaningful improvements, that was really kind of the basis. So we developed this, organized the categories around keystone projects, operational and safety. Those are the projects like we know that we need to stripe some high emphasis crossings here. Maybe we need those pedestrian signal buttons don't work, as well as a set of longer term visions that could be implemented over time through, for example, through a long range transportation plan program. Next. And recognizing that it was a large geographic area and there's a lot of political influence, we wanted to make sure that we developed a prioritization scheme so that you could set this using this sort of tool that we developed around a set of major goals, including mobility and safety, planning and funding leverageability, as well as public health. We looked at these corridors through a lot of social, economic, and safety lenses to be able to say, you know, hey, if you were to start a particular project here, this is where you would kind of begin using some objective criteria that builds upon a lot of other initiatives. Next slide. And some of these things that were quite interesting we had to continue to go through here. This was sort of the set was over on the left, and we looked at everything from where do we see the highest incidences of crashes to where we saw this thing called vehicle capacity ratios. This is when we really recognized that we had an issue going on, particularly when it comes to equity. Next. And I showed a couple of people crossing, you know, the 4-lane divided facilities. These are areas that, quite frankly, the traffic volumes have declined tremendously over the last 30 years. And so we would have these essentially what amounts to as overbuilt corridors. So people that are taking the bus, and a lot of our high frequency transit ridership, the high ridership locations are along older, overbuilt arterials that are in economically disenfranchised areas predominantly, and yet they don't get any improvements because, you know, they were built 35 years ago, thinking that at the time the traffic projections were going to continue to grow, and yet they don't have a capacity issue anymore, so they're not prioritized for improvements. So this is where you have these issues at 5 and 6 a.m. when somebody's trying to go to the stop, they end up getting, you know, hit. So we see a lot of accidents in these locations. So that became one of the places that we really tried to focus in on, and we're working with our DOT. These become, if you will, the laboratories for, you know, road diet projects. Next slide. And this just kind of shows historically traffic volumes going back, and I would say people pull the volumes 30, 40 years back, and you'll really, it really reveals where we have some issues at. Next. So some of the concepts, we'll kind of go through these a little bit. I think this is really almost less important. What you do, you know, there's no one size fits all complete street project. How you reallocate that space, you know, is really contingent upon what the community wants and what works within the space. And so that really becomes less important, I think, than what the ultimate outcome is getting us to some safety and livability. So we step back 50,000 feet in a lot of these locations. You can continue to kind of go through these a little bit, and really are there opportunities not only with just how we can catalyze redevelopment as well. So we looked at a couple of concepts of roundabouts. Some of these were near older commercial locations. We have a site in Jacksonville called the Gateway Mall where a lot of people take the bus. How could that site be redeveloped into a bus hub? This is one of our key high frequency corridors where BRT runs. It's a classic 4-lane undivided facility, which isn't standard. We do a lane elimination, but actually convert that outer lane to an exclusive shared ride bus lane. Next slide. this is Main Street, which runs right out of Jacksonville. It had a streetscape project, but we realized that it was actually doing more harm than good because it was creating a set of blind spots. People would cross in certain areas and you couldn't see them. So, what if we kind of revisit that? This is also a candidate for a road diet. Next. This image I showed earlier of a person cycling over a limited access expressway. People do this to get to, there's a community college on the other side. And what if we actually tried to put some actual amenities in here and create a separated multi-use facility on the bridge to get people from the destination, the college, to the stops near a BRT hub as well. And this final Keystone project, this is near a university, has a tremendous amounts of transit ridership, particularly to the neighborhoods to the east of here. Can we reconfigure that intersection and provide some safe crossings? And this kind of stuff really looks, so not only are we looking at it just as a safety improvement, but I mentioned earlier, it's just really about how do we connect community and how can we be a catalyst to redevelopment. And as I sort of wrap up here, some of the takeaways, and we had a lot of challenges early on, really defining what this program, this Mobility Corridors Complete Streets program was. It went, as I mentioned earlier, from just how do we fix a stop or how do we put a sidewalk connection to how do we really think about it, bigger picture. And so really being clear and coming up with a message was important. Coordinating because as you know, a lot of these facilities are often controlled by the local jurisdiction or the DOT. So making sure everybody's on the same page to work together, and JTA at least having a source of funding to do design and construction really helps. But I think this really illustrates the importance of transit's role in shaping the design of their street facilities, particularly where transit is the predominant mode. And then we also had some resistance to some of those projects as well. People often get uncomfortable if they haven't done them before about, going out and simply restriping an outer through lane for a parklet or an additional transit lane. So things of that nature. Next slide. But some of the lessons learned through all this, and you can't illustrate this so much, but to really be mission-based thinking, what are the real kind of issues that you're trying to solve? How do you really stick to that message? And particularly when it comes to elected officials, you need to build champions around this. And I mean, that's the number one lesson. And hit people, you got to hit people in their hearts as well about the stories and this whole idea of just how can Jacksonville work to get off of this dangerous by design list really became the calling card and a basis for us to think differently about our spaces and how can we make things safer for our transit riders that are actually going to work and serving our communities. This transit-driven approach. The other big issue is, I would say, attractive collateral is very important. We developed a coffee table book to really sell this program and the importance, and with high-quality graphics so that elected official that doesn't want to read a 300-page document can see what's happening and how they can champion a project much more easier. And again, the importance of don't swallow this elephant. Use tactical urbanism. Use demonstration projects around your transit stops to be able to get things done. And to really, I think ultimately, it's making us rethink this first and last mile. Next slide. What that really means. Rich's the work at APTA is so important, and how, what is the catchment area? But as you start to really delve into that further, what are those boxes of responsibilities? Because, we can think about a quarter mile between somebody's house and the stop, but there's a lot of elements within that and levels of responsibility, and to think about, what is it even at the first 50 feet and who should take that on for a lot of people. And so that's really one of the things that we're hoping to continue to examine about that, is to really look at that at a more granular scale and really develop a set of, identify those issues, those human factors, and think about how maybe even transit agencies can become much more involved and much more, taking if you will, a leadership role in the design of streets. and having more influence and potentially funding to be able to do projects like this and not have to worry about jockeying for position to, put in installing a bus lane or a cycle track or something that connects to a stop that would really benefit their customers. Next slide. So this just kind of illustrates what that is, what's really walkable in these kind of conversations about who's responsible about that. So that's something that we really hope to examine further in detail about this. Next. And really the next steps right now we've got 4 keystone projects that are in a preliminary engineering design phase, and we're continuing to identify opportunities for more funding. And the great thing about this whole message is really what came out of what was initially a project to fix some stops and sidewalk connections has become really a program of transit-driven complete streets. And I recall the board of directors at JTA, when they saw this, they were like, this is one of the most important things that we should be doing as an agency. And so that, really hit home with them, and they feel like, so the idea now is to continue to identify funding opportunities to do this work. And we're also publishing the story and the method in a future TRB publication that will be coming out, I guess, anytime before the end of the year. Next slide. So, that's just one of the things that we often leave people with. But again, build champions, and I just cannot underscore the importance of transit agencies having a much more influential position in the design of our facilities, particularly the high-frequency transit network. And with that, I think we'll take questions.
Thank you, all the presenters. This is something that I think we can all see the importance of across the nation. We're now at the Q&A portion of our webinar, and I want to encourage you to go ahead and send in your questions while we're doing the Q&A. We have a couple at this point. Hopefully we'll receive more. First, I want to begin in a response to something that Fred just said about the question pertaining to funding or removing barriers or penalties to creation of bike and transit lanes from state street funding. We had some legislation in Virginia a couple years ago that VTA supported that preserved the state street funding or road funding while also allowing for bike lanes or transit lanes, dedicated bike and transit lanes, because otherwise the localities would have been penalized for their funding had they dedicated any lanes. So that's one thing that we did to eliminate some barriers, but it also leads to another question about moving forward. What are some funding sources for complete streets? What have some localities or regions done to generate some funding to move in this direction? So Fred or any of the others want to respond to that?
I could jump in here really quick on the federal level. First of all, if that's okay with you, this is Rich Weaver again. The FAST Act has a program called, which has formula grants for enhanced mobility of seniors and individuals with disabilities. It's the 5310 program that I think folks are familiar with. And several localities and transit agencies have used those 5310s to patch up sidewalks. In other words, there was a missing patch of sidewalk or that connected to their fixed route, a stop or station. The Utah Transit Authority is a really great example of using this as an important enhancement. And once they did, they found that ridership increased, not just for persons with disabilities, but ridership in general. So at the federal level, that's one source to consider. I know it's eligible for other things, and it's in great demand, and you have to, in your coordinated plans and programs, you have to really make a case. But you can make a case that this paratransit, if you can reduce the paratransit service and get folks on fixed route, cost will really be, and customer service will be improved. And I just want to mention another program because it's really new, and we'll see how it works out. It was actually passed on Tuesday, and in the elections out in Denver. Denver had a really challenge with building sidewalks that were accessible to bus stops and station, and there was a lack of them, and it was a very patchy network. But part of their 937 million bond initiative that got approved, it dedicates 30 million to a new sidewalks to transit program, which will help repair and upgrade access by foot to nearby light rail stations, bus stops, and bike share stations. And I think that's really important that we keep track of that. It's definitely in the right direction. It also cities like Nashville and Los Angeles Metro has a sidewalk to transit program. The LA Metro was very successful in passing a referendum a year ago, and they are really on recognize the need to set aside a really good program for first and last mile program, as they called it, and using this as a template to prioritize which sidewalks to transit get implemented. And so those are just a couple examples that I'm familiar with, and I'm sure there's a lot of others out there as well.
Yeah, Rich, Fred, and those are spot on, as well as BRT funding. I think if that's $5307 can be used. They specifically cite up to a quarter mile for pedestrian connections. So some of these corridors, particularly the one I showed on Lem Turner, we were going to use the BRT funding to allow those improvements to take place, because I know for biking it may be up to a half mile or a mile what the threshold is, that you can use those funds that connect you directly to a stop. And then the other thing that we did in Florida when we looked at these programs is that FDOT often has a resurfacing program, or what they call a 3R, and I'm sure there's similar program in Virginia that, a lot of these projects can be done through resurfacing schedules. So we would try to gut these corridors with a resurfacing project, and that's the opportunity to look at doing some of the restriping, particularly if we're looking at a lane elimination, a road diet, as well as new sidewalks. So those are, opportunities, if you will, to do these projects without without having to get separate funds, if you will.
Okay. Well, thank you for that. I know that the city of Richmond is also talking about having additional funding go towards sidewalks with their program to try to eliminate any pedestrian deaths, the Zero program. So I have one more question. The other question that's been submitted is, are there any examples of complete streets in Virginia that you can highlight, or areas that are considering them?
I suppose we could say Arlington has good examples of, I don't know if it's a complete streets policy, but we can certainly maybe dig that up and search for it. But in Arlington, they have done a great job of doing safe crosswalks, and then they've done actually crosswalks in areas that, were typically people were going across lanes that were that they probably shouldn't be. They've been jaywalking, I'll use that term, but they decided they're using this is a path that they're using to go across from the station to the public park. So they're restriping, putting lights in for just pedestrians. So you press it just for pedestrians. So you're alerted that a pedestrian's crossing. And I could certainly dig up some of our working with NEMO and see if where cities are in Virginia are implementing complete streets policies.
Hey, yeah, I would echo what Rich said, and I believe Alexandria too has, I guess they come to mind when I think of their bicycle and pedestrian plan and how it adds multimodal usage. Even though plans are separate from the policies, I'm sure that is definitely a resource to look at when including how to implement them in practice.
Lisa, that was a question. It was coming in very choppy.
Yes, same. I couldn't hear.
Okay. That was the last question we had.
Oh, okay.
So at this point, I was just reiterating that we have recorded the webinar and it will be posted soon on our website, vatransit.com, under the presentations tab, and it will be